one of the biggest insights that I think that I've ever come across is just that healthcare, for as challenged as it is and as expensive as it is actually one of the only consumer nirvanas out there, in my opinion. And what that means is that the better the quality of care that you get, the less you typically end up spending.
Welcome to A Swift View on Health. My name is Wally Goma, and I'm here with my business partner, Scott Schoenvogel. Hey, today we're going to talk about Scott. So let's just start from the beginning. Let's talk a little bit about your career in hospital finance and consulting as you worked with hospital systems around the country.
When I started my career, I worked as a financial operations consultant with large healthcare systems and physician groups. That opportunity and role was what I like to call blue collar consulting. And what that means is that we weren't sitting in an office somewhere doing strategy and other leave behind guidance books. We were actually in the trenches, side by side with the employees, trying to figure out how to do their individual jobs better. And what I didn't appreciate at the time, but now I look back on and I feel so fortunate about, is that trench work forced me to really do myself all of the jobs, so to speak, across the healthcare system. And when I did that, I took it upon myself to really try to learn and understand how all those different roles kind of came together to make the whole healthcare system work. Led to a lot of questions. I put myself in maybe a lot of meetings and situations where I didn't naturally belong, but I just wanted to understand how all the pieces fit together. I really appreciated the opportunity to learn from the inside out and at all different levels of the organization how things really work. And that created a platform which down the road allowed me to connect dots that many of my other peers could not.
So, Scott, you obviously took those learnings and then pivoted to actually running the financial operations for Texas's largest hospital system. Did your point of view about our employer-sponsored insurance industry change, once you were on the inside running the operations of a specific health system?
I do think they changed in a large number of ways. I think what you find is that communication becomes almost the number one priority, because otherwise it's really hard to get people to march to the same beat. And when that doesn't happen, thousands of times over, you get to some pretty serious messes. But I appreciated, kind of the pressure that scale put on me. And honestly, outside of that scale, I started to really appreciate the role that a large healthcare system plays within the community, the state, the country. We were dealing with, a whole range of issues. I thought I had learned everything I needed to know about how hospitals and physician groups operate, but I was starting to learn as kind of a leader in a large organization, it's not just about what you do internally, but it's about how you interact to a lot of your external constituents and partners. And so, that phase of my career was really an opportunity to connect even more dots, to even broader sectors of the healthcare system. And that was really important. I think the other thing that is just a point of view that we all need to respect is that when you're running a incredibly large organization, let's say you have 10,000, 15,000, 20,000 employees or more, that's a lot of families that you have responsibilities for. They are counting on their leaders to make the right decisions, that keeps them employed, keeps, roofs and over their head and food on their table, right? And so, the amount of intentionality that went into decisions was was next level. And I was coming from the consulting world, we had a relatively narrow focus. I wasn't as prepared for the amount of risk management and risk mitigation that was actually required, to protect the integrity of an entity that, may have been in business for over 100 years.
Scott, I know for a lot of years we've joked that when you were running financial operations at the health system, I was the president of an insurance company denying your claims, and that you would just resubmit the claims that we denied with different codes and they would fly right through. But it was during those years that I think you started to really see how healthcare costs were impacting employers, self-funded and, plan sponsors. And so you really defected to the other side of the fence and you launched one of the country's most successful and largest, price transparency navigation companies, Encompass. So like that's a big change. Talk about what motivated you to sort of drop your nets and leave to really come and lead and found Compass.
Yeah, I'd like to, think of myself as very purpose oriented, and I wanted to feel like I could actively pursue solutions that would make a real impact in healthcare. And once I learned enough, to have some of my own thoughts around, what might help, I really was looking for opportunities to do that. And there can be opportunities within the organizations itself. It just happened to be that my particular roles and organizations maybe were kind of constrained, by the scope of responsibility. And thus I felt like I needed to kind of step out and embark on, creating something new completely from scratch. That's a whole different conversation and learning in terms of going through that process and, what went well and maybe what didn't go well. I think that, what we saw at the time, and I think continues to be a lesson going forward, is that the forces in the healthcare system, even though they might be well intentioned, often create scenarios where certain values get out of balance. And one of the values at the time was that we were trying very hard within the healthcare system to have super high integrity, uh, and only tell, members and our patients what we knew we could kind of guarantee to them. If I said this to you, then you could count on that being absolutely the facts. And what happened was our overall dynamic was so complex that we often didn't know, exactly what the outcomes were going to be. For example, what would things really cost? Like we honestly could not tell you. Um, and so what I think was happening is that we felt like we had skewed too far. We were like, hey, we're trying to risk manage. We can't be entirely accurate. So we're just not going to share any information. And, we could sense that that lack of information was really creating a lot of frustration uh, and just, kind of pent up demand out there in the marketplace. And I saw, a real opportunity that if that information was shared, it would allow us to align patients to the care providers that could provide them the very best care. Um, and in many cases, that was the healthcare system that I worked at. But in some cases, while we may not have been poor, there may have been others that were better. And having that kind of, democratization of healthcare information, I thought was, very important. And we went through, our in that business, an entire journey around moving from price transparency to navigation to tools and people and process that enabled all that to come to be. And then honestly, when we transacted that company, it was really the strategic decision around what are the platforms where we can embed that type of understanding and knowledge that would make it even more accessible to people and pursue that.
I'll tell you, that was a exciting time, for our industry when price transparency was coming into the marketplace, when the market was starting to realize that the contracted rates within the same insurance network could vary dramatically from provider to provider. And, I know in just a number of years, you grew that business from, zero to supporting millions of lives and thousands of employers around the country. If you could go back in time, knowing what you learned at Compass, would you have done anything different being the CEO and founder of that really successful enterprise?
Yeah, I think that, when you start a business and you've never done that before, there's just an endless list of, ideas and needs uh, and focuses that actually you don't know. And without that experience, it's really hard to get ahead of them. And I think that, one of the important concepts that we had that we look at today that, I think about a lot is just really make that kind of permanent change and transform healthcare, not just within a market, but within the country, within the world. It's like, how do you get to that critical momentum to be able to do that? And sometimes we call that the snowball effect. We start small, but it gets momentum. The next thing we know, we've got a whole huge snowball or avalanche or whatever that may be, and that critical mass or momentum necessary to kind of get that spinning and cycling is I didn't know how to do that. And if I'd gone, if I could go back, knowing what I know now, I would have positioned us and our business and how we attack the market in a way where I think we could have, seized more of that momentum, particularly within, kind of that unique time period, that unique opportunity that we had, because it was kind of the perfect time and the perfect opportunity. And so how we seized that moment, once again, I think we could have done even better. I think we did well with particularly the resources that we had, since we were, I think the least funded company that had ever entered that space. But I believe that we could have had even more of an impact if I had had better perspective.
Well, I'm sensing a pattern here because you were, on the hospital side of the industry, feeling a little restless that we could do meaningful work to impact plan sponsors, to impact employers, patients, so you launched Compass. And I know in your last few years at Compass, you became, focused and passionate about we could actually launch a health plan, what the industry now calls an alternative health plan. I mean, we actually came up with that acronym years ago when we were launching and co-founding Simple Pay and Coop Health. So, like, what were you seeing at Compass where you sort of maxed out the opportunity that then said, "We're going to go do this again and start a new business all over again"?
One of the biggest insights that I think that I've ever come across is just that healthcare, for as challenged as it is and as expensive as it is actually one of the only consumer nirvanas out there, in my opinion. And what that means is that the better the quality of care that you get, the less you typically end up spending. And it may not be in that individual moment, like you may pay more, for example, for an office visit than you might have paid going somewhere else. But at the end of the day, the quality of that office visit puts you on a path or a trajectory that totally transformed your healthcare journey. And at the end of the day, kept you healthy, prevented you from escalating, and changed the trajectory of not just your own health outcomes, but also those of really the group that your health is associated with, which is your health plan. We're health plans, and then at a broader level, health insurance, right? We're aggregating up all the health of all of the people on those plans, all that, both kind of opportunity and risk. That's all coming together. And I wanted an opportunity to build a health plan design that aligned those two factors. And that's really where I think alternative health plans have come in, is that they've seized upon, that kind of gap or opportunity where if you are able to connect, high quality with particularly lesser costs, on the member side for behavior change and good decision making, all of a sudden that can create this domino effect that once again creates a totally different, experience for the patient, but also for the health plan, and ultimately for everybody else that's involved. And so we were, felt like on our navigation platform, we just didn't have the right partnerships, to put that together, to create that, start that cycle, start that snowball effect. And when we transacted that business, I felt like we just, it was right there, just beyond our grasp. We need the opportunity to go grab that. And fortunately, found a great partner in you, Wally, and we were able to go do that.
Well, I'll tell you, it's been a fun ride, launching and scaling the alternative health plan. We're going to have an episode on that, as a standalone episode because there's just a lot to discuss. But here we are, and you're doing it again, and you've launched and we've co-founded Swift Health together, which is really kind of going in a different direction now. You've been on the provider side of the industry, a point solution side of the industry, ultimately running a carrier health plan with the alternative health plan, and talk a little bit about Swift and what's your real passion behind what's next.
Yeah, I think from a Swift perspective, we've just now built up so much perspective on what works and doesn't work, where there are opportunities, just the ability to identify innovations that will matter. And, I'm just super passionate about bringing those new ideas, those breakthroughs to the market in a way that accelerates their adoption. Clearly, there's tremendous challenges facing the healthcare industry. I truly believe that health is the greatest good. Like if you're not feeling well and healthy, like nothing else matters. And all you need to do is be really sick to know that truth. And so, our ability to help the industry more broadly, have um, that kind of accelerated mindset for innovation and improvement, is how I want to end my career. And I, I'm really excited to partner with you and hopefully bring that insight and see if, together we can continue making a strong impact.
Well, Scott, obviously, I've been blessed and fortunate to have gotten a chance to work with you, a friend and a brother, but really a true industry expert, one of the foremost experts in the space that you've been in. Really excited to see where we go next. Hey, and to our listeners today, we really appreciate you doing a little bit of a history tour on Scott Schoenvogel. For now, stay cool and stay swift.